Hello, thank you for attending our talk entitled Structural Vulnerability in Transgender and Non-Binary Decedent Populations, Analytical Considerations and Harm Reduction Strategies. At the time of this recording, it is approximately 20 days into 2021, and 12 transgender people have already been murdered or died by suicide this year alone. Though lifespan estimations are difficult to generate, this graph summarizes global and US premature deaths of transgender people in 2020. Clearly, these decedents experience disproportionately higher rates of fatal violence. While activist groups have long advocated for victims, forensic anthropologists have only recently begun to address transgender issues in casework and research. In the following slides, we outline the utility of a structural vulnerability framework in assessment of transgender decedents, ethical responsibilities, and harm reduction strategies for anthropology casework.
We were inspired to write this paper after hearing Soler and colleagues' 2020 AAFS presentation on structural vulnerability. Structural vulnerability is defined as a positionality that imposes physical and/or emotional suffering on specific population groups and individuals in patterned ways. It is a product of the complementary forces of class-based economic exploitation and cultural, gender, sexual, and racialized discrimination. Structural vulnerability assessments have been applied in healthcare settings to identify vulnerable patients and plan equitable care to meet their specific needs and circumstances. Soler et al. Proposed the application of structural vulnerability assessments to forensic anthropology casework and detailed the issues inherent in identifying decedents from marginalized groups. They focused on undocumented migrants, but we were immediately reminded of the parallel issues that exist in transgender cases. This chart compares the challenges Soler and colleagues noted in the identification of migrant populations to our findings in the identification of transgender individuals. It is compelling that in these two groups, the challenges are remarkably similar. We attribute that similarity to the entrenched systemic inequalities facing marginalized groups in a capitalist system. Perhaps most notably, public outreach and new collaborations are increasingly important, as anthropological methods alone often cannot resolve identifications of marginalized group members.
We know that physical bodies may record the biological consequences of structural vulnerability. Vulnerabilities can also manifest in the case file in the lack of available antemortem records and in bias and misrepresentation in initial reports in unidentified persons databases. We emphasize that specific data and statistics on violence towards trans individuals is difficult to gather, and it's often undertaken by advocacy groups due to underreporting and lack of adequate record keeping by law enforcement. This is an issue that we see parallel to the crisis of missing and murdered Indigenous women in North America. Still, assessment of indicators of structural vulnerability may help anthropologists recognize potential trans cases and understand and plan for the unique challenges of identifying these individuals. Like Soler et al., we explore these vulnerabilities using the temporal phases associated with the assessment of skeletal trauma. First, antemortem findings indicative of experiences throughout the life course. Second, perimortem vulnerabilities relevant to trans deaths. And postmortem vulnerabilities related to the treatment and investigation of remains, as well as the involvement of families of the missing and deceased. We will explore these issues in the next 3 slides.
We emphasize intersectionality in our work too. Besides gender, multiple aspects of an individual's identity, including race, class, disability, sexual orientation, and physical appearance, interact to influence the life and death experiences of individual trans persons. Anthropologists should consider these factors holistically. During life, systemic marginalization can result in social, economic, and health disparities in family structure, income, and access to resources, and more. Factors related to social insecurity can include disintegrating family support networks, susceptibility to interpersonal violence, and difficulty obtaining proper identification reflecting name and gender identity, leading to inability to secure employment. Social insecurity issues underlie economic and health issues. Lack of access to housing may stem from the inability to secure accurate ID cards or open a bank account. Trans individuals may also experience economic insecurity as a result of discrimination in the workplace, access to only low-wage employment, or other barriers that may result in the need to enter unsafe work environments. These are nested issues, as social and economic insecurity can also have biological consequences due to poor access to nutritious food, health, and dental care. Because healthcare is widely linked to only certain types of employment in the US and private insurance is out of reach for most, trans individuals experiencing hardships in housing and employment will almost certainly experience health insecurity. Transgender people may also experience discrimination in healthcare, leading to adverse outcomes, including refusal of care or improper care by medical professionals.
The totality of these life experiences could manifest in the skeleton as antemortem trauma and/or nonspecific indicators of stress. These skeletal indicators have been noted in other marginalized groups, like migrants, though similar data might not be knowable for transgender decedents. In addition, a lack of antemortem care results in non-existent or scarce antemortem medical and dental records, which can complicate identification even in presumptive ID cases. Structural vulnerability may also be visible in the perimortem interval. As a result of discrimination, transgender and non-binary individuals may be denied life-saving care. They also face increased risk of violence, including suicide, homicide, and intimate partner violence, which can manifest as perimortem trauma. This may be seen in the cause and manner of death, as well as in overrepresentation in forensic cases. Simultaneously, bias and errors in law enforcement's initial reporting can influence subsequent identification and investigation efforts through the effects of cognitive bias. Gender identity might not be accurately recognized in the initial stages of a death investigation. Important context, including gendered clothing, genitalia, and secondary sex characteristics, may be misinterpreted.
Finally, we can explore postmortem indicators of vulnerability, including those resulting from analytical limitations in trans cases, continued issues in reporting and documentation, and complex family relationships. One limitation of forensic science is that biological methods, including those based on skeletal remains, can only determine biological sex, which may not match lived identity. Gender identity can only be confirmed after an individual has been positively identified, and knowledge comes to light about how that person identified in life. We emphasize that prioritization of sex without consideration of context clues does not make reports more scientific or more objective. After death, reporting and documentation issues continue to affect case outcomes. Initial and continued misgendering by law enforcement can obstruct search and identification efforts.
We see a similar problem with databases such as NamUs. While this platform assists identifications by providing a national registry of missing and unidentified persons, it can also impede identification because it prioritizes biological sex over gender. This problem is exacerbated because an individual's lived identity may not match the name and gender listed on their government records. Postmortem identification efforts, therefore, often uncover an individual's dead name, rather than the name they used and were recognized by at the time of death. Family relationships can also impede identification. Unsupportive biological family members may misgender or dead name decedents in reports. Some families may also refuse to initiate a search or to collect remains once identified.
Recognition of potential trans and non-binary cases is only part of the equation. Anthropologists have an increased burden of ethical responsibility when working with individuals from marginalized communities. We propose that anthropologists adhere to these basic ethical responsibilities in potential trans cases, including acknowledging that the existing binary, Jane or John, for does not encapsulate lived experiences for many decedents, and therefore anthropological expertise alone will not be sufficient to achieve identification. Abiding by harm reduction principles in research as well as identification, and working toward the development of best practices guidelines. We hope that this paper is an initial step toward that collaborative effort, which will take conversations among anthropologists, advocates, medical legal professionals, and law enforcement.
We also propose specific harm reduction practices that anthropologists can implement now in their own labs, in their communications with law enforcement, and with colleagues in casework. First, we can perform blind analyses of sex estimation to avoid cognitive bias. We can include footnotes on sex versus gender in case reports. We see this as similar to the common practice for the anthropological definition of perimortem. We can include gendered context clues in case reports. For example, masculine or feminine clothing, evidence of gender confirmation surgery, and more. We can use inclusive and accurate language and avoid using gendered pronouns and terms to refer to unidentified persons in reports, as this gendered language in the case file may create persistent bias. We can also begin conversations with medical legal authorities and law enforcement about challenges in identifying transgender decedents. And finally, we can avoid using a checklist approach to assess cases wherein individuals must fit into rigid criteria to be considered trans. Checklists cannot account for diversity of presentation in sex and gender, and they end up making scientists the arbiters of gender. Identifying the decedent will often result in dead naming if the individual has not legally changed their name. Anthropologists should understand and be prepared to discuss the importance of a chosen name with law enforcement and medical legal professionals, and we can advocate for investigation beyond dead names. We need to recognize that after a decedent has been identified, further harm may come to them if their remains are returned to unsupportive next of kin. Anthropologists often have no control over this part of the legal process, but when there is compelling evidence to back a lived identity, professionals can prevent further harm to the decedent, their friends and their chosen family, and their community members by respecting that identity and communications about the case. Finally, anthropologists should ask for and accept assistance from trans-informed community members and advocates during the investigation process, as we know that detailed interpretation of remains, associated clothing and artifacts, and recovery context is necessary in cases with scant evidence or long postmortem intervals.
Harm reduction also applies to designing research studies. While research focused on skeletal correlates of gender identity may generate important data, such studies also pose ethical concerns. We encourage anthropologists to consider the following. Research on trans bodies, by definition, prioritizes biological correlates of gender. This not only contradicts how gender is currently understood, but also recalls historical abuses in medical research. Research focused on the biological causes and features of non-binary gender and sex is rooted in the idea that these are pathological conditions that must be fixed. This assumption has served as justification for non-consensual medical intervention, conversion therapy, and eugenics, and demonstrates why many in the community have a legitimate fear and distrust of this type of research. Also, research on trans bodies necessarily requires accessing medical records, a greater level of invasiveness than is required for research on other groups that can be more easily anonymized.
We have proposed a structural vulnerability assessment that anthropologists can use to recognize the complex issues involved in the identification of trans and non-binary individuals. We've also proposed ethical responsibilities and protocols for harm reduction that anthropologists can adopt in these cases to prevent further harm to the decedent, their memory, and their biological or chosen family. This is the beginning of a dynamic conversation, and we invite anyone listening to collaborate as we continue to work through these ideas with the goal of creating best practices guidelines. We don't have all the answers yet, but we urge that anthropologists need to be aware of the role they play in these cases as potential advocates and/or in introducing bias and other harm. We especially encourage the inclusion of more trans and non-binary voices within our own field and among the students entering the field.
Finally, we recognize that important conversations do need to happen surrounding additional ethical responsibilities. We emphasize that these discussions must include and prioritize trans and non-binary voices. We open these questions to you, and we do invite you to collaborate. We want to acknowledge and thank the following people and organizations for their assistance with this paper, and we encourage everyone to follow the links here for more information.